discuss an epidemic that has emerged in America, the opioid epidemic, with Georgia ranking 11th of the 50 states with the most opioid dependency and opiate-related death. Drug use has been an issue for as long as man has walked this earth, and today it affects all walks of life, poor to rich, affecting the user and anyone connected closely to the individual. But what makes the use of opiates an epidemic is the astonishing rise in its occurrence over the past decade. From year 2000 to 2015, the rate of opioid-related death has increased 200%, according to the Substance Abuse Research Alliance, better known as SARA. This is on average 90 people a day dying from opioid overdose. Over the next few minutes, I will go into detail on the severity of the issue America is facing today. I will explain why this has occurred and what is currently being done to alleviate the problem as well as to prevent it from reoccurring. But first, I'm going to explain exactly what an opiate is and with the help of Sarah's research article. Prescription opioids and heroin epidemic. An opioid comes in three forms. Natural, which is derived from the poppy plant, which is morphine and heroin falling within this category. Then there's semi-synthetic, hydrocodone and oxycodone, which are your usual take-home prescriptions. And finally, synthetic, which is fentanyl, usually administered in hospital settings or taken home as a patch, and methadone, which is infamously known as the alternative to previously mentioned and is administered at clinics in the hopes that the individual will reduce and eventually stop the use of opioids altogether. This drug is to be the transition from heavy opioid use to no use in efforts to alleviate physical withdrawal that the patient will endure. Opioids are a class of drugs that act on the body's opioid receptors, specifically the mu receptors, and they block the transition of pain within our body's nervous system. And at the same time, they trigger the release of dopamine, which is a neurotransmitter responsible for our body's pleasure and reward system. Upon its release, it ignites the feeling of euphoria, which is why opioids are commonly abused. One of the major side effects of opioids that contribute to the overdose epidemic is the respiratory depression. Another serious side effect is dependence. After repeated use, the body becomes tolerant of the drug's effects and physical and mental dependence occur. This is the reason an individual would take in more of the drug to get the same euphoric feeling that they received in the beginning of their drug use. This phenomenon makes the individual more susceptible to overdose, as it is easy to miscalculate just how much more their body needs to achieve that same state of euphoria. Once dependent on the drug, the individual cannot abruptly stop taking it without enduring the following side effects: agitation, anxiety, muscle and bone pain, insomnia, vomiting, and diarrhea, which is why so many individuals prolong their drug use and why treatment facilities should be in place to safely get the person through withdrawal. Now that we understand what opioids are, let's discuss the accessibility to it and why it has contributed to the epidemic. Okay, so according to Laxmaha's article, Opioid Epidemic in the United States, efforts to increase opioid use in a campaign touting the alleged undertreatment of pain continue to be significant factors in the escalation of prescriptions and opioid analgesics. Opioids are prescribed at alarmingly high rates in America for those experiencing chronic pain, and stronger doses are prescribed to cancer patients as well as those who have endured accidental injuries such as motor vehicle accidents. The issue that healthcare providers are finding is prescribing safely to those who are in need of the drug. As a nurse, I can tell you that in nursing school, we were taught pain is whatever the patient says it is. With that foundation to practice in mind, the customer is always right, and healthcare providers are not to minimize the patient's perception of their pain. Many patients have taken advantage of this healthcare practice and subsequently go to physicians' offices and ERs with complaints of pain in the form of drug seeking. Sarah, of previously mentioned, illustrates the following as the highest propensity for opioid abuse: those who are involved in doctor shopping, receiving overlapping prescriptions from multiple providers and pharmacies, taking high daily doses of prescription pain relievers, having mental illness and a history of misuse of substances. being of low income status and living in rural areas. According to the Center for Disease Control and Prevention, people at highest risk for heroin addiction are those addicted to prescription opioid painkillers, cocaine, marijuana, and alcohol. People aged 18 to 25, and those living in large metropolitan areas and not having health insurance. Now I'm going to throw a couple of statistics at you to help you understand the significance of the epidemic. Of 1,300 overdose deaths in 2015 in Georgia, 900 or 88% were due to opioids. The state experienced a statistically significant 10.2 increase in overdose death from 2013 to 14 and a tripling overdose death from 1999 to 2013. Even more alarming, recent data from the Georgia Department of Public Health indicated that deaths related to drug overdose surpassed deaths related to motor vehicle crashes in 2014. The economic burden of prescription opioid overdose, misuse, and disorders in the U.S. is estimated at $78.5 billion in 2013. And some estimates indicate that healthcare costs associated with opioid misuse in Georgia have increased 80% since 2007. Now that we understand just how serious the problem is, what is being done to stop it? According to Sarah, Congress has enacted 3 forms of legislation. The Mental Health Parity and Equity Addictions Act of 2008 and the Patient Protection and Affordability Care Act of 2010, which give people greater access to substance abuse treatment. And finally, of most significance, in 2016, the Comprehensive Addiction and Recovery Act, enacted through Obama. This one had the greatest effect undertaken by Congress to address the opioid epidemic. It authorizes $181 million each year in the new funding to fight this epidemic over the next 10 years. Its strategy entails expanding prevention and education efforts while also promoting recovery and treatment. In detail, it will target 7 key areas to minimize the national issue. First, it will focus on education and prevention. Second, it will expand the availability of the drug Narcan to law enforcement agencies and other first responders in the reversal of overdose in order to save lives. Third, it will work with incarcerated individuals so that they are able to get the treatment that they deserve. It will also launch a medication-assisted treatment program, which entails that everyone misusing opioids should have access to the full range of treatment services, including medically managed detox, withdrawal management, behavior therapy, medications, and recovery support services. And finally, the Act encompasses strengthening the prescription drug monitoring program to help states monitor and track prescription drug diversion. So far, we have discussed the incidence of opioid abuse in the U.S., with Georgia specifically, and the astonishing number of deaths that are associated with it. Some may say, to each his own, let them live their lives to their liking, but when hundreds of thousands of lives are being taken to irresponsible prescribing, lack of knowledge to the potency of the drug, and untreated and undiagnosed mental disturbances leading up to these catastrophes, then something needs to be done. These victims should not be put into the category of junkies or deserving of their fate. The previously mentioned initiatives need to be taken seriously, and education needs to be spread throughout all communities in order to give awareness of the issue at hand and to make prevention and treatment options known.